Good morning, everybody. Uh, Respected judges and dear friends, there's no financial disclosure. So we will be presenting our work on using low concentration atropine 0.05% in children who were non-responders to 0.01%. So IRB approval and ethic committee approval was taken. Who is a non-responder to 0.01%? A non-responder is a child who, despite using 0.01%, still progresses at a rate of 0.5 diopter per year. And so all the children who were taken into the study were progressing despite using 0.01%. All the routine investigations, ophthalmic workup, orthoptic evaluation was done, especially pupillary size, near point of accommodation, and convergence, because we were using a higher concentration of atropine. Now, the mean age was 6.5 years. The glass power before starting a higher concentration was increasing at a rate of 0.71 diopters per year, and after switching over to 0.05%, the progression reduced to 0.22 diopters. One patient did complain of receding of near point of accommodation, and we gave him bifocals. So the axial length growth also slowed down, but there were 4 children out of 30 who still were progressing despite using a higher concentration. And we all know now that 0.01% atropine is now used to control myopic progression. Most of the studies have shown good results. There was a wonderful case report from lamp 2 trial where they showed that axial myopia progression is indeed dose dependent. They did compare 0.01 and 0.05% and found that 0.0% was more efficacious. However, they did not use it in 0.01% non-responders. So that is where our study is of importance, that in children who are not responding to 0.01% or the rate of progression is not very good, the control is not good, 0.05% can be used there. The factors responsible in the 4 children: one of the child was very young, he was 5-year-old. 3 children had a parental history of high myopia, and out of these 3, one of the child was progressing rapidly prior to 0.05%. So the rate of progression did reduce with 0.05%, but it was still more than 0.5, and so we still kept him in non-responder to 0.05%. So in conclusion, we believe that low concentration atropine eye drops 0.05% is useful in non-responders to 0.01%. Why it is important is that it would be wise to switch to a higher concentration in children who are not responding to 0.01% low concentration atropine eye drops for preventing the progression of myopia. This is mainly for axial myopia. Thank you so much.
Any systemic side effects noted?
No, sir, not at all.
Any local?
Sir?
Any local side effects?
No, no
Local.
local. One patient did complain of blurring for near vision.
Okay.
In that patient, we gave bifocals.
How long was the follow-up with 0.01?
0.01% we followed for 1 year, madam.
Only 1 year. So
Yeah. No, 1 year is more than enough. I mean, if you don't get response in 1 year, you are not going to get response. Even the atom 1 or atom 2 study.
Atom actually said 2 years.
No, madam. For dubbing them as non-responder, they did not say 2 years. They published their results for 2 years. So it was a study done for 2 years. But we presented our data in 2018 follow-up work. If for 1 year the patient does not respond to 0.01%, the patient would not be responding in another year.
And how many years have you followed up with this 0.05?
1 year, madam. Only 1 year.
They
Yes,
have
yes.
actually responded well.
Yeah, I mean, 26 responded well, 4 still did not respond.
So the washout period is also the same concept.
The washout period of 0.01 or
0.05.
so we still don't have the rebound for that. We have not stopped them yet.
Okay. Thank you.
What age would you continue?
Yes, ma'am.
Up to what age would you continue?
So typically, like if we go by the published results, we would be continuing till 14 years of age, but published data does say that you can continue for 2 years like Atom 2 did. With if our experience or the routine experience of clinicians, we do continue till 14 or 15 years of age. Some children we continue for 3 years also. My own data in 2018 we published or presented was for 3 years.
systemic associations also in these children?
No, no, madam. These were purely school myopia children. I mean, the progression of myopia was axial. There were no syndromic patients, no ROP patients, no patients like that, Marfan's, nothing like that.